Hey, Dr. Derek Nielsen here, the owner of this clinic, Kaizen Physical Therapy, here in Durham, North Carolina, where I help people who want to be active and mobile, whether that's running, hiking, cycling, walking on the beach, going up and down stairs, whatever that activity is to you. I want to help you maintain it while not being in pain. But today I want to talk about how the right exercises will help you overcome pain for good while avoiding pain medications, steroid injections, and surgery. So I'm going to try and be quick with this, but I am absolutely going to change the way you think about weights and resistance bands and open up your mind to a whole new way of thinking. And you can see my stairs here. The more you know, the better decision you can make. And that's what this is all about. I'm here to open your mind so that you can ultimately make the best decision for you. So let's jump into it. One of my mentors told me, if you want to impress people, make things complicating. But if you want to help them, make things easy. So I'm really going to try and make this as easy as possible so that I can help you. So first things first, these right here, a resistance band and some dumbbells. What are they typically used for? People would say resistance training, building muscle. But in my world, they're actually used for something completely different. And let's jump into that. So this is what I'm going to do today, is how changing the way you think about bands, so resistance bands, resistance weights, and movement will decrease or abolish your pain for good. And the big idea is assistance, not resistance, but assistance. So you need assistance if you have back pain with walking or running. We need to find out where is the actual problem, where's the root cause of the problem, and we can do that with assistance. If you have sciatica pain with standing, I don't know where the problem is. I know there's pain with standing, but I can start to identify if we do some assistance. We can start to identify where the problem is. If you have knee pain with stairs, again, I don't know where the problem is, but we can start to identify it if we assist it and it gets better. Shoulder pain with reaching overhead, same thing. I don't know where the problem is, but if we do some assistance, then we can start to identify where the root cause of the problem is. But we don't just stop there. So our tools are resistance bands and light weights, but we also have body position. So this one is huge. Body position, we have our postures here. We've got the easiest posture is called supine, which just means laying on your back, while the hardest posture is standing up. And the reason why I show babies here is because this is called the neurodevelopment model. And this is the way that we grew. This is how we developed as babies. And as a baby, you don't have a mobility problem. You have all the flexibility that you need. You really have a strength and instability problem. So you have a weakness problem. And that is the reason why you can't go from lying on your back to standing day one, is because you have a weakness problem. And so if there is a problem here, again, let's say you have pain here, interchangeably, problem, well, I'd say that's pain. So if you have a problem or pain here, I don't know what the problem is, but I can start to identify it if I change your body position and perform a similar or same movement and your body responds differently. Then I can start to identify if there's a weakness problem, because again, you need the most amount of strength and stability for this and the least amount of strength and stability for this. So if we perform the same movement here, and then do the exact same movement in this position and it feels better or it looks better, we know that there's a weakness problem. So that's where these positions really come into play. And so let me ask you, which one is harder? What exercise is harder to perform? So we've got a simple bridge here, a bridge without a loop band and a bridge with a loop band. Which one's harder? Most people would say this, but it's actually, this is harder. And the reason why is by me pushing out against this band. Now, sure, I have to use a little bit of strength to push against the band, but by me pushing out of this band, it forces my core to activate. It's going to force my glutes, so the muscles in your butt, it's going to force those to activate, which assists me in the movement. So the band is forcing me to turn on certain muscles in my body to perform this movement. So this position is here. So we start here with positions on your back. So this is the easiest position. And if you perform a bridge and you have low back pain or low back discomfort, low back tightness, or let's say you even have cramping in the hamstrings, let's say you have some knee pain with that, then we need to perform assistance. We need to assist you to make sure that we retrain your body to move the way it was meant to and activate the way it was meant to. So it's not just about, hey, let's perform this bridge. Does it look good? It's, what do you feel? When you do this bridge and you lift up, what do you feel? Do you feel your thighs, the front of your thighs doing the work? Is your low back doing the work? What areas in the body are doing the work to lift you up? If you say something other than the glutes, the butt muscles, if you say anything other than that, that should be the main area doing the work. But if you tell me a different part of your body's doing the work, we need to assist it. We need to assist it. Now, yes, I could say, hey, Susie, it should be your butt doing the work. Go ahead and squeeze your butt and do the bridge. And while that works in the moment, that doesn't retrain movement. It retrains that particular moment in time. So again, I could say, Susie, I know you feel it into your knee, but you really should be feeling the muscles in your butt should be doing the work. So go ahead and squeeze your butt and lift. And Susie could say, oh yeah, that feels better. But that doesn't mean we retrain the movement. We retrain this exercise. We got you to squeeze your butt and work the area that we need to, but we didn't retrain the movement. The band will start to actually retrain the movement because I'm not telling you what I want you to do. I am giving you an exercise that forces your body to give us the result that we need without you knowing what I want. Okay, I hope that makes sense. If we really want to retrain movement, we get the exercise that matches the person in front of us. We don't get the person that matches the exercise. So I'm not just trying to force an exercise on you and say, this is what you should feel. This is how it works. No, it's perform this movement. What do you feel? Then we give you the exercise that matches what you need. That could be a band around the knees. That's assisting you. That could be a weight in your hand and pressing up. That's assisting you. That could be a band in your hands and pulling out. That's assisting you. The goal is always the same. The goal is, does it look better? Does it feel better? What muscles are doing the work to perform the movement? The exercise that works for you is the exercise that we need to give you. I can't just say squeeze your butt and lift. That just doesn't, it doesn't work long term. It doesn't retrain movement. We assist you with bands and weights to force your body to activate the way we need it to, and that starts to retrain the movement. So we do assistance first, then we remove the assistance and we do it without it. The second that this were to feel the same, I'm assuming that you need this, right? I'm assuming. But the second that this feels the same as this, we move on. Because now you don't need assistance anymore. We retrain the movement and we move on to the next exercise, which is we change the body position. Okay, I will keep harping on this, so if you don't understand it, don't worry. I'm going to keep repeating myself because I know it's a very hard concept for a lot of people to understand, and the last thing I want you to do is leave this more confused than when you started watching this video. So which is harder here? Okay, which one's harder? This here or this here? Now the difference is here I have a loop band around my front of my shin, the back of my leg. So I have a loop band there. This is harder. Again, this is assisting me. It's assisting me with the exercise. It's helping me stabilize. It's giving me some strength assistance, if you will. It's making me rely less on my body, and I can use that band to help me stabilize. So the other question is, okay, so let's say we go in this position and you have a little bit of discomfort in your low back. Well, if I put the loop band on you and that low back discomfort disappears, we just found something out. We found that there's a weakness problem in this position. But the other thing to that is what muscles feel like they're doing the work. The front quad, the muscle in the front of your thigh, should be doing most of the work. You should also be able to sit up tall. This foot in front should be doing very little. So it's about how does it look? How does the movement look? How does it feel? What's doing the work? And with every movement, there should be certain areas that are doing the work. There should be a certain way that it feels. There should be a certain way that it looks. And we can change that with assistance we change that to make your body perform the way that it needs to. Again, I can't just say, hey, you go in this position, you feel a lot let's assume you go in this position and you feel a lot into that front foot. You tell me, hey, it feels like a lot of the work is coming from this front foot. Well, Susie, how about you just squeeze this front thigh here and let's start retraining that. Go ahead and squeeze that front thigh, start working on that. Again, that could work in the moment, but that doesn't retrain movement. It just doesn't work long term. We have to make the exercise match the person, match the individual. So this loop band can start to retrain your body to work the way it should. I could also put a weight in my hand. I could also put a band in my hand. Again, and I would ask you the same questions. How does it feel? What's doing the work? And how does it look? And that, when we get the result that we need, let's say that I put a band in my hands and that gets exactly what I'm looking for. That makes no low back pain or discomfort. The front of the quad's doing most of the work. This front foot's not doing a whole lot of the work. That's where we start. We use the band in the hand. And then as soon as the band in the hand feels very similar to no band, we move on. Because you don't need assistance anymore. This is how we start to retrain movement. So the last one, which one's harder, A or B? You can see I have a loop band in my elbows, around my elbows, whereas there's no loop band around my elbows there. And I hope you got this now. Yes, this one is harder without the loop band. This one's easier. What the loop band is doing around my elbows, by me pushing out against it, it's forcing me to activate here. It's forcing the muscles to work. And by forcing this to work, it can help out with my hip. It can open up my hip. It can change what areas of the body feel like they're doing the work. So again, we start to retrain movement. Again, if this doesn't look good, it doesn't feel right, and it doesn't feel like the correct muscles are doing the work, then we start to assist and we see if we can find the exercise that matches you, not you matching the exercise. I never put an exercise in front of you and say, this is exactly how it should feel. I ask you, we need to ask you, what do you feel in your body? And then we match the exercise to what we want you to feel. Okay? So we do that with assistance and body position. But here's the recap. We assist movement to retrain your body, and one main way to do that is with bands and weights, not just strengthening. I know a lot of people will tell, or a lot of practitioners and other physical therapists, chiropractors, whatever, will say you have a weakness problem, when in actuality that can be part of it. But a lot of times if all we do is work on strength, you're not going to find the solution that you're looking for, because there's an actual movement problem, not just a weakness problem. And so we need to start retraining movement, and we can do that with these bands by assisting movement, but we can also do that with body position. So let me ask you this, which one is harder? The thing I want you to focus on is just the body position. So I'm rotating here. I'm turning to my right, and I'm turning, yes, it's to my left, but let's assume that it's to my right. Let's assume I'm rotating right here and I'm rotating right here. The only thing that's changed is I'm on my knees versus standing. Which one is harder? This one, A, is harder. And the reason why, if we go back to here, if we go back to way far, if we go back to here, standing requires the most amount of strength and stability. Here, kneeling, which is what I was doing in that other picture, requires less. So kneeling is an easier position than standing. So the correct answer, this is harder because I'm standing. So if there's pain here, or it doesn't look right, or it doesn't feel right, then we change the position. Okay, did this change the way it feels? Did this change the way it looks? Okay, if it did, we could assist in this position. I could put a loop band around your knees and assist. Did that change anything? If it's not changing anything, we change the position again. And we find what movement and what exercise works for you, opposed to I'm giving you an exercise and this is what you should feel. That just doesn't work. It doesn't work to retrain. If we really want to retrain movement, if we really want to find a long-term solution to pain, we have to find the position that works for you. We have to assist the position, and we have to progress things. We don't just force you into a box and say, do this cookie cutter program and do this exercise, do this exercise. You have weak quads, you have a weak core, you have weak glutes. No, we need to find what exercise works for you, and we do that with assistance. We also do that with body position, and we ask you, how does it feel? How does it look? And what muscles are doing the work? And we retrain those. So which is harder? Let's focus on my neck, okay? So I'm standing here. I look funny in there. But look, I'm standing here and I'm rotating my neck right. Just focus on my neck, nothing more. My neck and head. Rotating my head right. Rotating my head right, lying down. Don't worry about my arm. So which one's harder? Standing and rotating my head, or lying down and rotating my head? Standing and rotating my head is harder. Again, it takes, let's go back to, I'm skipping ahead, but it takes, lying down and rotating my head is the easiest position. Standing and rotating my head is the hardest position. It requires more strength and stability here. So we can change the position to see if the way it feels changes. So let's say, let me go back here. Let's say I have you standing and you turn your head and you say, oh yeah, I feel discomfort, it hurts. Okay, what if I lay you on your back and you rotate your neck? What does it feel? Does it feel different? If it does, we just discovered there's a weakness, instability or weakness problem. If it didn't change anything, then we can start by assisting you. We could put a weight in your hand. Did that change anything? I can put a band in around your knees. Did that change anything? I can make you squeeze something between your knees. Did that change anything? I could put a weight in your left hand. Did that change anything? Okay, and we can start to assist with movement. And again, once the assistance feels the same as without assistance, we move on to the next position. So recap, we assist movement to retrain your body. One main way to do it is with bands and weights, but we can also change your body positions to change the difficulty of the movement. So again, easiest position, hardest position. We find what position you need based on how it feels, how it looks, what muscles are doing the work with the given exercise. We find where your starting point is. Then we can assist wherever with every single movement. So here I'm doing a leg raise, a straight leg raise. This weight in my hand is assisting me. It's forcing my body to activate my core and my trunk, which in turn can open up this leg and allow it to move better, allow it to move easier, and act the way that it was meant to. And if that works for you, we start there. Again, that doesn't necessarily mean this exercise is going to work for you. We have to test. We put a weight in the other hand. Did that feel better? Did that look better? Are the right muscles doing the work? We could put a band in your hand. Did that feel better? Did that look better? The right muscles doing the work. And then we can change up the body posture. So I hope that made sense. I hope that helped understand how assistance really starts to change the way the body feels and move, as opposed to, hey, squeeze your glutes when you do this exercise. Hey, squeeze your core. Tighten your core when you do this exercise. That's the way it should feel. That will work in the moment, but it just doesn't work long term. We have to retrain the body, and that's why we assist with weights, resistance bands, and that will start to retrain the body for actual long-term solution to the problem, as opposed to a squeeze here when you do this exercise. That just doesn't work. All right, so listen, I have an offer for you. If you're serious about finding a long-term solution to pain, I would love to help. What this is it's an initial assessment and treatment visit. It's a $49 limited time offer. I'm not sure how long I'll be offering this, but what it will do by the end of this appointment is I'll give you a diagnosis for what's causing your pain. I'll answer all of your questions, and you'll obviously know exactly what's causing your pain, and you'll know how we're going to get rid of it. You'll know the steps that we're going to take. Typically how long it takes for people in your position to find a real long-term solution to the problem, and you'll avoid painkillers and surgery and get your life back. Again, if you want to be active and mobile, you want to get back to hiking or running or biking or weight training or just going on a walk or going up and down the stairs without pain, then I want to help, and I want to help you avoid painkillers and surgery. And I want to help you live the most active and happy life that you can. So start with this $49 visit. Click the link that's around this video. Let's get you into the clinic. What you'll do is set up a phone call with the clinic. It'll most likely be myself or my associate. We'll be able to ask you some questions so that we can learn more about you, and then find out if it seems like you're a good fit for us, if it seems like we're a good fit for you. And then if that is the case, we'll make the appointment and have you come in, and we'll start helping you find relief immediately. All right, well, I look forward to talking to you soon. Thank you so much.